there. Welcome back. It's Coco again. This time we're here to talk about how we work together as a team. So thank you for being a part of the team, and I hope that this presentation helps you to really understand the bigger picture of how Illume works beyond your role, whatever your role is. So here we go. We're going to start here and look at the patient care process, which is more or less a picture of our entire operations, more or less. So what happens is, in general, something called an inquiry will come in, all right? So an inquiry will come in that says we have a patient who, it might come from a hospital, where it says we have a patient that is going to be discharged in a couple of months, and we're looking for a home health agency to provide care for that patient. It's a patient who needs 16 hours a day of care, and it's a patient who has a vent and a trach and a GJ tube, and has the occasional seizure. So would you be able to help us take that patient in 2 months, we'll say. So then we go through a process to see if we can actually do it, and then we communicate whether or not we can, and that process is all part of our referral and intake process. So when it's a continuous care patient, what happens here, or what's supposed to happen, is we go through a process to prepare for that referral, and we go and visit the patient and the family in the hospital. We have the care team. We start to design out the care team who will be the case manager, and we start to identify who the nurses will be who will care for that particular patient. We start to introduce them, typically in the hospital if that's where they're coming from. If they're in the home and we're going to transition them in the home, then we would go to their home. We also like to do a little bit of, we like to do a home visit regardless of whether they're in the hospital or not. We like to see the environment, understand for ourselves how we would want to set the environment up so that it will be workable and have all the places for our nurses to provide the necessary care in the home. So that's important. We also, in this time period, try to communicate a little bit about what they should expect. And so again, I'm talking about continuous care here, not skilled medical, but with continuous care, the message we want to send is that it's a process. It's a process to get to having a fully staffed, well-humming team. And what we try to do in our standard that we try to set is that we don't like to take on a new patient until we have 70 to 80% of the total schedule filled. Now, that might surprise you, positive or negative, I'm not sure, but we usually do not and are not able to start a case at 100% staffing. It is a little bit like, trying to get the universe to converge in one small intersecting point to get a team of what's typically somewhere between 3 and 6 or 8 even nurses to all come together, have the right skills, and be ready to work, available to work, and then start all together. It's really quite of an act of God. So, which is why our onboarding process and our interviewing process is such a big deal, and why these tapes and videos that you're watching are part of our system to help navigate and bring you into a place where you're ready to go out into the field at a moment in time just when you're needed. And we want to keep you, and we want you to be happy, and we want you to be working. So we try in the referral and intake process to manage the expectation such that we will bring in a team of 70 to 80% of the total number of hours that the family needs. Okay, so then we start. And at the start of it, so then what happens, we go into admission. And admission happens when, with the continuous care, the admission will take probably several hours. And the case manager will be there oftentimes, so will another case manager or an SCS. Oftentimes they do it in pairs. And usually what we try to do is open the case with with the first person who's going to cover the first shift. And sometimes we do a training with all the nurses during that admissions process. And when that works, that can be very positive. Sometimes it doesn't work out logistically to do it that way. We always make sure that when there's any kind of vent or trach or any kind of equipment that's used, that you've been trained on it and you're competent on it before you run solo, for sure. So it's very important that you participate in the trainings and for each individual patient. So each patient, there will be a certain amount of training that you will need, and it's really key that you make sure you're present for that, or you cannot fill the shifts. And if you don't fill the shifts, then the parents and family, of course, is left, out to dry. So we do the admission, and the admission process is, all the parts of getting the start of care going and the 485 out. And the 485 is what the RN will use will have created and worked on prior to the first day, but it needs to be signed by the doctor. And so there's a coordination there with the remainder of the caregivers who are care providers, the home health aides and LPNs, shift nurses, to let them know what the care plan is, so that you can provide the services in the home. And it's possible that there will be, they'll tell you what the care plan is and it hasn't been signed yet by the doctor, and you'll want to follow the care plan as best you can that's been given, but it might evolve a little bit if the doctor makes any changes. So be aware of that. So then what happens is then we go into this little box here that just says provide care. And this is really where the extension of period goes on, where we're doing visits. You're doing visits if you're a care provider. And we're going through the ongoing process of doing visits, documenting, turning your notes in, and doing the 10 steps of remarkable care in every single visit you do, and you provide the care. Now, in that same process, what's happening in the background is, we're doing our best to make sure that family's full schedule is filled over time. Getting the right match between family and caregiver is somewhat of a challenge. We do our best to bring in the very best caregivers, but not every caregiver is for every family, and not every family is for every caregiver. So there usually is, after we first onboard a patient, it might take some time to get the exact right mix of care providers for that home and for that family, and for that care provider. And so we there's a sort of a couple of months that go on where we fine tune and sweeten up and make sure everything is the way it needs to be. Our goal is to get to a place where that family is at a place of stasis, of things are running smoothly, and they can start to predict that their life is going to be kind of predictable and normal, and that they can trust that whoever says they're going to show up on Monday morning at 7 a.m. will be there. So if your participation in this, if you're a care provider or a shift nurse, that act of showing up every day on time, being ready to provide care, and complete your notes and go about your business, that piece is so important. It's this little tiny box, and it's really such an important box. It's not really a box, it's narrow, right? But so that's where you provide your care, and that's where all the good stuff happens. Our goal is, okay, and we ask everybody in the entire company to help with the goal of getting to a place where that family has what they need, and they have care providers that they can trust, care providers that show up and are there consistently without calling out, and that they're providing good documentation back to the case manager and to their other team members, so that we can all coordinate and do best by the family. And then at some point, if there is a discharge, then this is where the discharge would take place, out here. So this is the operations of what happens with the patients. And in order for this to happen, we have to do all these other things as well. All right. And so we need to at all times be present and aware of the quality assurance piece. And so you will be receiving in your email every week, you'll get an email that it has a video that's a quality assurance video. And these are really short videos. They're usually about a minute or 2 minutes long, and there's something for you to focus on. And we ask that you take a moment to just watch it and know what it's about, because the person who's quality assurance is looking at all the notes and seeing what's coming in and seeing little things that if everybody were to work together, then we could correct these little bits that keep returning. And the time that it takes to send a note back to you and then have you either correct it online if it's an electronic note or actually have to come into the office to correct it, that's a lot of wasted time. So the quality assurance videos that come out are intended to help you do your job in a way that handshakes with everybody else and brings the level of care and the level of coordination up. Compliance is also a piece of this. So we have all kinds of requirements that we're bound by to regard. We have requirements for Department of Public Health, for CMS, the Center for Medicare and Medicaid. We have requirements, labor laws. We have requirements that are brought to us by our insurance company. We have all kinds, how we handle our cyber technology, all kinds of compliance. So these things are happening in the background, and it's important for you to know that when we ask you to do things, it's because we're trying to be compliant, we're trying to provide quality care, and we're asking you to help us in the best way that we can. And these people are working so hard to try to make sure everything is in order and provide the safe work environment for us to operate and not worry that we're out of compliance. Think about that. Like, you don't have to worry that everything is compliant and that things are running in a quality way because of the work of these other people. And then we have the billing piece. And the billing piece is sometimes, I don't know, for some reason in healthcare, it's like anytime you talk about money, it's a bad thing. The reality is that money is energy. It is a way for us to be empowered to do the work that we do. And it's important. And it's a real part of what we do. It's not everything. And the way I try to look at it and the way that the team looks at it is we use money to fund our mission. We use money to fund our values. We use money to fund our goals and our purpose and our ability and our attempt to try to create something remarkable and lasting. So billing is so important because without it, the energy that we need, which is money, to fund everybody in the field and all of the tools and resources that we pull together in order to make the home health agency work, we need to have billing that works. And billing is dependent on everyone, okay? Everybody in the field, especially, understand that when you do not complete your notes on time, billing can't happen. And without billing, we have no way to fund the remarkable care and the people that are here. So billing is key, and one of the things that we want you to be really responsible about is the awareness of your handshake with billing. It is not a bad thing to be thinking about billing. Think of billing as the way to promote our future and to fund our future as a company and to a way for us to do the good things in the world that we want to do. So please focus on getting your notes done on time and turned in, because it's a compliant issue and a quality issue, and it's good for all the reasons of communication, but it's also a way to make sure that we continue to stay funded. The next piece here is payroll, right? And so your ability to get your work done will predict your ability for payroll. And so we have a group of people who focus on billing and a group of people who focus on payroll. And they are focused on this in a most incredible way. There's a process they go through every week that's dependent on everybody in the company working together to complete their notes in an orderly fashion, have everything compliant and in the quality assurance checked, so that we can go ahead and bill and run payroll. All right, so if we look here at the patient care process, this is a slide that's I think important to be aware of. It's all the different pieces of the patient care process and who's involved. You'll see there's a lot of things that go on with every step. And so I talked about some of these things, but just briefly again, the inquiry process is where we think about the patient, decide, assess whether or not we can work with them. We start to think about staffing. We think about the schedule. We think about how it's going to be paid and whether or not that payment source is one that will pay us or not. Because believe it or not, there are pay sources that don't really pay. So we evaluate all that, and that's done by the SCS, case manager, biller, scheduler, administrator. Those are the people who get involved with that. Next, we go on to referral and intake, and this is coordinating with the physician orders. We're working with the RN case manager, has a startup care checklist that she or he uses. We also look at the evaluation of eligibility for payment. Insurance payer, we look at insurance payer, we look at where exactly the patient is located, we look at the staffing. Do we have the nurses and home health aides? Can we get them? Is there additional therapy staff that is needed? Is there a clear skill? Is there clear clinical skill that's needed? Is the person homebound, in particular for Medicare? Medicare participants of home health have to be homebound, for example. Getting a verbal order in place, getting a face-to-face from the physician, and identifying who the physician of record is going to be, who's going to be the person who's signing all of the orders. And we also need to develop out the schedule and have a clear schedule for who's going to work when we start. We also need to set up the patient in Access and in T-Sheets and in QuickBooks or our financial system. Then we do the admissions, and this is where the start of care begins, right? And at the start of care, the patient booklet is handed out, patient rights are reviewed, consent, individualized emergency plans are developed, which everybody who cares for the patient obviously has to be very clear upon. You also have to be very clear about what the patient rights are. You need to know what the evacuation plan is, you know, what level of acuity the patient is. There's the actual assessment that takes place, which if it's a person who's over the age of 21, then OASIS is done. And there's a plan of care. The part of the admission is the 485 is completed. Send and receive the signed orders. OASIS, if it's a Medicare or someone over 21, OASIS transmission takes place. We also think about supplies, if there is any supplies that are needed in the home, and how to coordinate getting those supplies ordered and how to get them paid for. There's all sorts of document management that happens, what happens in the home, what documents are there, what needs to be there at all times, how are you storing your information, all the emergency preparedness details, and there's also the planning for recertification or discharge, and case conferencing. So there's a lot that goes into the admission process, and this is, in this stage, we have the case manager involved, the SCS, the medical records person is involved, the biller is highly involved, and emergency management is also involved. Then we start to provide care, and then we schedule, so what we do is we schedule out 60 days of the episode, so a full episode, 60 days, and provide care to the patients and do the visits and shifts, which is what care providers go out and do. Documenting of all visits is what the care providers all do. Case management, which is what the RNs, the case managers, are responsible for doing ongoing. All the revision of orders that takes place and getting those orders signed and sent back. Visit verification, managing transfers whenever they're needed. Interdisciplinary meetings that take place to ensure that everybody knows how to best care for the patient. Incident reporting, anything that goes on, if there's any incidents that happen with the patient or in the home. Billing, of course, needs to be taking place. Quality assurance is taking place every single day. Compliance is taking place every single day. Payroll we run every week. There's supervision that's required. So you are required, if you are an LPN, to be supervised. And this ownership is not just on your supervisor, this is on you. You need to make sure that every 28 days you have a meeting and are supervised by your supervisor. And if you're a home health aide, that needs to take place every 14 days. So this is your responsibility to make sure you get that supervision. It's part of being compliant. It's a requirement by DPH and by CMS. Also during this time is when there's any resumption of cares, any recertifications, and any SCICs. And so all of this is happening. You may be going and doing your visits, and in the background, all these other things are going on. So care providers are involved, case managers certainly involved, SCS, medical records, biller and payroll, emergency management. We're all busy doing things. Discharge is where there's a discharge checklist that's followed. Payer documents have to be completed. Case conferences have to happen. Paperwork has to be done within 2 days of the discharge. Final OASIS transmission has to be sent off, and sending and receiving of final signed orders. And of course, billing is taking place. So case manager, SCS, medical records, biller, and payroll all involved. So it's a pretty coordinated effort. And so sometimes we get in our own little world and don't realize what everybody else is doing. But you're part of a team, of a big system, and everybody's doing their best to keep that ball rolling forward. So, this is the patient care process, another way to look at it. So here comes the internal referral and intake. And what we do is we are always going then, billing and authorization, scheduling, start the care, go on, and here's where the visits are taking place, the supervisions are taking place. This is for care providers. This is usually where you live, right? If you're a shift nurse or a home health aide, this is where you live. Just remember that this is where you are, and there's all this other stuff going on. It's trying to support you, and it would be great if you would be aware of it and try to support those members of your team that are trying to support you. There's also this part of the care process, which is run by the case manager, any transfers, research, resumption of care, and you have your discharge. So this sort of centerpiece is the part where probably most people think this is where the care happens. But know that there's all these other things that are going on. There's OASIS transmissions, which affects our ability to bill. It also communicates to CMS what our patient statuses are, and it affects the outcomes, how we measure our outcomes, how we're rated. Our star agency rating is based on what goes into the OASIS and at the different OASIS time points. Quality assurance is checking everything throughout. So these are the parts that you need to just be aware of. This is the bigger engine that goes on. So why is it important to discuss the patient care process? I think it's important for people to know. I think when you know the bigger picture, you can be more valuable and you can feel empowered and you can go, oh, that's why they're asking me to do that. It's not just because they're awful and they are trying to make my life difficult, but because, boy, there's good reasons for it. Notice where there are so many places of coordination, right? And there's a lot of, I've been in a lot of businesses, and to send a bill in this business is so much harder than it is in any other business I've been in. I'm not kidding you. So somebody comes into the store and they buy, a shirt, they pay for it, right? The cash register person goes and they make a bill, say you owe $25.73, and you pay the bill, and that's it. Here, in order for us to get paid, you have to do like 27 different things. You have to make sure you have the signed orders. You have to make sure that the face-to-face is done. You have to make sure that all your OASIS time points are accounted for. You have to make sure every single note is compliant and is quality assurance checked. You have to make sure that you haven't done more or less than what's on the plan of care. All these things have to happen before you can bill. And that is a lot of responsibility. So the coordination with that, and again, remember that the billing is how we fund our mission. It's how we fund being able to do what we want to do and help families and make this all possible. So the coordination of all of it is really astounding. Just imagine all the places where problems could occur, right? Think about all the places that a problem could possibly occur. So a typical thing that happens is we send an order out to be signed, and the doctor won't send it back. They're just busy, they don't get to it. Well, guess what? We can't bill until that order's been signed. Another place where we get hung up is somebody doesn't get their notes in on time. We're waiting for the notes, we have to wait. So that's where problems can occur, right? If somebody's supposed to go into work and they don't go to work, that's a big problem. It's a big problem for the family. It's a big problem for, needing to make sure the scheduler knows and making sure that we communicate with each other, try to find a replacement. So the question I want you to really drill into out of this discussion is, what is your role in the process, and how can you be a part of making this easier for all of us? And so every time, you are aware and make it easier, we actually, guys, we as a team have an easier time. And when you show up on time and you leave when you're supposed to, and you complete your notes when you're supposed to, and you get things back to us, it actually means that we have to spend less time chasing you down, and our costs go down, which means there's more opportunity for us to fund the things we want. So every time you don't get your notes in by noon on Monday, for example, if it's a paper note and we have to chase you down, it's time that we have to pay for somebody to chase you down. Or if it's a note that's in 24 hours electronically that's not completed, somebody has to be paid to do that. So that affects us all. I hope you see how important that you in the process affects the full team, and how that can affect you ultimately. So what are the things you can do, that others depend on? So again, we talked about the notes. But think about it for yourself. What are the things that other people depend on? And what happens when you do not fulfill your part of the process? Just be present to that. And what could you do to help your fellow teammates? All right, so it's important for you to just think about that, to be aware of what that looks like, and do your best. Just do your best. So it is all about relationships at Illume. And so everything is interconnected, as this image is intended to portray. Everything is connected. So we have our patient, we have our care providers who are closest to the patient and providing care. And the idea here is this is supposed to be an image of surrounding everybody with remarkable care. And so our intention is, here's our patients, and we're going to, again, there's the care provider, and there's the case manager, and there's the SCS, and the quality assurance and compliance, and the administrator, and then we have, human resources and scheduling. They're here, and the finance and billing. We're all here to support the team. The administrator's here, and then we have the board, the governing authority, and the professional advisory committee. We're all here related to each other, and this line here is intended to show that we're all connected, we're all interacting with each other in various ways, and that we all need to be sensitive to each other's relationships. So your role, what is your role? So if you're a case manager, you're responsible for coordinating care, case management. The care team itself, it's your responsibility to be in touch with them and manage those relationships. The case manager manages, supervises, coordinates, evaluates, and develops client care and appropriate case management. Directs the team of care providers, provides direction to teams to ensure that clients' needs are met, provides or coordinates supervision to care teams as needed. It also includes trainings to make sure people are trained properly. They also need to conduct the start of care, the OASIS transmission, the OASIS assessments, other assessments, developing of the plan of care, ensures the 485 is signed, provides skill interventions. The case manager also ensures all documentation is complete on time for their patients, including other members of the care team. So that's part of your responsibility, to make sure your team is doing its part. Responsible for the development, coordination, and execution of plan of care, and manages, mentors, leads, develops, supports, and trains the members of the care team. So this is what the case manager's job is. We also have the direct care providers, the other RNs, LPNs, and home health aides that are in the field who provide the visits or shifts for clients as directed by the case manager. And your job is to, of course, follow the plan of care established by the case manager, and you're to recognize and report changes to the in any client or patient condition to the case manager immediately. And it's important to communicate information on a timely basis. Communication, verbally or written communication, needs to be accurate and documented. You have to document every time you communicate something verbally. That's very important that you say in your notes, reached out to the case manager. Then we have to make sure within your roles, you promote personal safety as well as the safe environment of your clients and your coworkers. You have to always ensure that safety and infection control practices are operating at a pristine level. Especially these medically fragile patients, they're so easily, their immune systems are so fragile. Responds, recognizes appropriately to potentially unsafe situations, knows how to use the equipment, makes recommendations for improvement, works together with the case manager to develop the 10-step curated care plan, participates in regular team meetings and trainings. So you participate in this training, in your 90-day training, and then the at least monthly training that goes on from there. And I would say here that it's also important for you to be responsible for your training, to be aware of where you feel unsafe or incompetent in any way, and raise your hand, say, I need more support. I don't feel 100% confident. A question I want every single care provider to really be able to answer a solid yes to is when they go out into the field and they're going to be left alone with a patient. The question is, do you feel you can handle any medical emergency with that patient? Do you know what to do? Can you handle it? Because if your answer is at all wavering, you need more support, you need more training. And so it's your responsibility to raise your hand and ask for support. Meets with case manager or other designated supervisor at least monthly. That's very important. And if you're a home health aide, then you need to make sure you're connecting with them in person at least once a month, and over the phone, or do a case conference at least every 2 weeks. So those are your roles. So relationship building and communication is important, and we do different things. We have different established rituals to help us communicate. So we have a monthly dashboard that takes place, and that consists of our board members, our administrator, SCS, general manager, scheduler, biller, financial manager. We typically do that on the third or fourth Friday of the month. I typically am the one who arranges that, and we typically do it in the LMA office. We talk about our company goals and objectives. We talk about the patient census. We talk about the pipeline of new patients that are coming on. We talk about our referral partners, our referral relationships, hospitals and other doctors. We talk about what's happening with recruiting and hiring, and we go through all the financials. Then we look at what happens. We have a monthly all-hands webinar, which if you haven't seen one yet, we will make sure you get to see the most recent one. Be sure to ask Taylor or someone in HR to help you with that. So what we do is we give an update on what's happening, and typically it's for all of our employees, and it happens on a monthly basis. It comes out sometime in the first couple of weeks of the month. I'm the one who generally does that. It's a live webinar that actually I usually just record it and then distribute it. And we update the company goals. We talk about company news. We talk about celebrations and company events. Sometimes I issue a challenge or an incentive. Right now, for example, we're trying to hire a bunch of people for a bunch of new patients we're bringing on, and so at this particular moment in time, we have some incentives in place where you can get a $200 bonus for taking on more shifts, for example. So the all hands webinar includes all that kind of good stuff. We usually talk about who the new employees are as well, and any promotions, as well as any education certifications or anything like that updates. So that's that's part of what our communication is. We also do weekly dashboards in the office. And I invite you, by the way, to come to these. You are welcome. You are all welcome. We do these Thursdays at, it says 12 p.m. here. Sometimes we do them a little earlier at 11. And so it's the SES administrator, general manager, scheduler, biller, founder, case managers, but really anybody in Illume is really welcome to attend. It takes place in the Illume office. We focus in mostly on our current patients and the pipeline of upcoming patients. We talk about the schedule. We talk about making sure that we're doing the things we need to do to ensure our families have the people they need and where they need them. We also go through and look at the details of billing status, payroll, any kind of training, what people are, if we're waiting for people to finish their training, all those kinds of topics. We also have a daily huddle that the case managers, the SES, the administrator, general manager, scheduler participates in. It takes place every morning at 8:30, typically. And the SES is the person who organizes it, and it takes place over a phone line. We talk about, very specifically about patients, upcoming visits, admissions, discharges, incidents, and complaints that have just recently happened or about to happen. So that happens. And then we have interdisciplinary meetings, which the case manager and all the care workers, therapists, SCS, administrator, scheduler, biller, caregiver, family, anyone else who can be involved. So it should take place on at least a monthly or quarterly basis, and it's arranged by the case manager. The location is decided. Sometimes it can be in the home, and then a phone line that people can call in. You talk about the plan of care, you talk about the curated care plan, talk about quality and compliance, documentation, you talk about anything related to billing, timing of orders, etc. And then we have the weekly case manager meeting, or nurse meeting, which is case managers, SCS, and administrator. And that meeting is now, it says Tuesdays here, but it's been more recently on Thursdays. And it's organized by the SCS. It takes place here in the Illume office. And the topics are patients, really. Plan of care, quality, compliance, documentation, billing, whatever is coming up and being dealt with. So the next area here is how we work together is supervisory meetings. So in your meetings with your supervisor, you will be talking about how it's going for you. How's it going with your patients? You should be looking at your role competency assessment, and you and your manager both looking to see how are you doing in terms of your role, and have an open dialogue about any areas that you need some support. It's also an opportunity to celebrate and also acknowledge you for whatever is happening in the home and what you're doing really, really well, because I know you are and you will be. We also sometimes will have the mentor supervisor focus on a particular Illume topic that we're trying to focus on. It might be related to the monthly training, or it might be something that as a company we're trying to get everybody to focus on or work on. It's a good time to review what your goals are. We like to always have goals and set goals for the following month. We also want to know how we can support you and make sure that you have what you need in order to be successful. All right, so those are some of the ways that we interact together, and I hope that it's helpful for you to have that review. If you have any questions, I hope you will reach out to your supervisor, to your mentor, or to me, or your SES, or your administrator to get clarification on any of these bits. Thank you very much, and go make the world a better place.